I'm Dr. David L. Katz. I trained in internal medicine, worked as a clinician for the better part of 30 years. Also residency trained in preventive medicine, public health at Yale, where I played various roles over nearly 3 decades, including founding and directing Yale University's Yale Griffin Prevention Research Center. So I'm a board-certified specialist in preventive medicine, public health, have co-authored multiple editions of the leading textbook on epidemiology and public health, and my career-long interest has been doing everything possible to add years to lives and life to years. The overwhelming response to coronavirus begs the question, where the hell were we before? I'll give you just one obvious example because there are many, but we have had the disclosure in really high-profile places, the Chicago Tribune, the New York Times, that the American food supply is willfully engineered to be addictive. Essentially, teams of PhDs are hired by big food companies giving marching orders to design food people can't stop eating until their arm gets tired from lifting it to their mouths. They get functional MRI machines to achieve that goal. They get a bonus when they get food to the bliss point. And essentially what that means is we are watching corporate America subsidize epidemic obesity and diabetes to fatten corporate coffers. This is hiding in plain sight, and I have been wondering and asking for years, where is the outrage? And yet, we pay no attention to it. So, all of a sudden, there's this massive mobilization to protect health because of this acute threat, when there are chronic, relentless, inexorable threats occurring at a massive scale, hiding in plain sight. And is it because the right people profit? Is it because the timelines are extended? Is it some combination of those? We don't get outraged. We don't do anything about it. And we pay the price in lives lost year after year after year. And the scourge of poor diet affects children and adults alike. And because it kills hundreds of thousands prematurely in the US every year, but it kills us by virtue of chronic disease, it doesn't just do what the virus does, which is cause death. For many years before causing death, it causes chronic morbidity. It takes life from years and then takes years from lives. The virus doesn't do that. And we don't display outrage, and we tolerate it. So it does beg the question, does some of this depend on who profits from what? Is this just about our inability to see grave dangers in slower motion? And because of the acuity of the pandemic, it has aroused a response that really would be warranted for many things that threaten health all the time, but we tend to turn a blind eye.